Do you have a kid who struggles with strong negative feelings, things like fear, sadness, anger, and the like? Well, this child psychologist has some ideas on how to help you help your kid process these feelings coming right up. Hi out there, this is Dr. Brett Pearce, child psychologist, coming at you with a video on helping kids process negative feelings. You know, if I had to sum up good mental health in a sentence, it would be learning how to have a healthy relationship with painful feelings. That may sound like an oversimplification, but I really do think it effectively represents the kind of final goal of all kinds of mental health treatments, because we typically don't struggle with mental health difficulties when we're dealing with a lot of positive feelings, but rather we tend to struggle when we're dealing with painful feelings. And kids are no different. Kids absolutely have the same capacity to feel things like shame, fear, anger, guilt, rage, trauma, and pretty much the whole host of negative feelings that you could think of. Kids can absolutely also struggle with problematic levels of these painful feelings. Now, how to help kids process painful feelings gets kind of complicated, and it gets complicated for a wide variety of reasons. One of the biggest reasons it gets complicated is because we ourselves, as adults, very understandably, have our own set of feelings. And when kids are struggling with negative feelings around us, it often activates our own negative feelings. Additionally, very commonly, kids have negative feelings that seem to be connected to our own actions as adults. Not because we're necessarily doing anything wrong, although there certainly are kinds of approaches to helping kids that can be fairly toxic, and there's approaches that seem to be more beneficial. But even routine things like setting a limit, like no, you can't have ice cream for dinner, can set off an entire storm of negative feelings, particularly for younger kids. The second reason that helping kids process negative feelings can be very complicated is because commonly any significant and persistent misbehaviors demonstrated by a kiddo, well, those things tend to be deeply connected with painful negative feelings. Happy kids don't misbehave that much, and when they do misbehave, it's not usually that big of a deal to handle and correct. And that's because misbehaviors, particularly persistent big ones, are deeply rooted in and connected with these negative feelings. So while there's no way that I could give you some kind of all-encompassing YouTube video on dealing with such a powerful and intense, nuanced, and sometimes complex thing, which is to say processing negative feelings, let's definitely talk about a couple of guidelines. So step number one, when you're dealing with a kid who has is having a big flood of negative feelings, let's maybe talk about fear or anxiety. And we'll use that as the example for this video so that we don't get too lost in lots of different possibilities. So let's say that you've got a kiddo who is maybe experiencing an acute attack of anxiety. The first thing that we need to do is we need to learn how to recognize what seems to be going on. In fact, we need to be aware that the kiddo is indeed experiencing anxiety, and that can be a little bit kind of mysterious. And I have done, cattail, I have done multiple videos on the subject of childhood anxiety, and I will try to remember to maybe include a couple of links in the description down below on those videos, because very often what we see outwardly, my cat is nudging the stand that my phone is on for filming this video. There we go. Speaking of processing negative feelings. So let's pretend that we're dealing with a kiddo who's got a lot of anxiety. What we have to do is help him recognize it. And as I was mentioning in previous videos, I've discussed how childhood anxiety very commonly can look like just misbehaviors. And that's what we see outwardly. And indeed, sometimes those misbehaviors are important for us to recognize and address for sure. But it's very difficult to process a feeling that we don't consciously realize that we have. So the first thing that we need to do is to be on the lookout for the feeling and be ready to kind of gently help a kiddo recognize and label that. Which is to say, we need to be ready to say things like, wow, I wonder if maybe you get really nervous, or you get a lot of worries, or you get a lot of anxiety. Because there's a substantial chance that even, a somewhat older kiddo, 8, 9, 10, 11, 12, even teenagers, even some adults, don't quite recognize when they're dealing with something as fundamental and as primal and as usual to the human experience as anxiety. So step number 1 is to recognize it in the kiddo and to try to label it. Step number 2 with painful feelings, such as, for example, anxiety, is we have to be ready to slow down a little bit, and in ourselves and in the kiddo, we have to watch out for one of 2 little gremlins that come up when we're dealing with emotional pain. Gremlin number 1 is the desire to jump into urgent action in order to get rid of or to try to ward off or kind of solve the painful feeling. Now, again, I'm talking about feelings by themselves. If you're in a situation connected with the feeling where urgent action really is merited, like, I don't know, kiddos panicking because there's a fire in the kitchen, we deal with the fire first, right? But most of the circumstances where we are dealing with a kiddo who's experiencing negative feelings, usually there's nothing that urgent going on. So that's gremlin number 1. We have to watch out for the desire to jump into urgent action with the kid. Like, okay, I can't tolerate the fact that you're anxious because that's painful for me to see that you're in pain. And so I'm going to jump into action with you, trying to get you to knock the feeling off or whatever it is. I'm either demanding that you stop it, or I'm frantically trying to fix circumstances that are bothering you in order to get you to release this feeling. Because it's difficult to have a wise and healthy relationship with a painful feeling that we are vigorously and urgently trying to get rid of, in a sense. And you'll probably see why the second gremlin is more like the desire to kind of stuff away or avoid or numb off or deny. Some more like other side of the coin, unhelpful way of approaching it, which is to say, not jumping into urgent action, but instead being in a kind of denial or avoidance of a painful feeling. And what you would likely see with anxiety is, I'm anxious about something, and so I have to frantically jump into action over it. Like, for example, I'm really nervous about my grades or getting in trouble with my teacher, so I am constantly checking and double checking my grades and a potential email from my teacher to make sure that nothing bad has happened. And it can be sort of like scratching an itch over and over and over again, failing to see how we're doing more damage, which is creating more itchiness, and et cetera, et cetera, et cetera. On the flip side, it also doesn't do for us to surrender to a kind of paralysis with kiddo, which is to say, okay, well, something's going on here. I think maybe the kiddo's anxious about school, and maybe that's why he's freaking out or she's freaking out in the mornings when we're trying to have a morning routine to get ready for school or what have you. But what I'm going to do is, because I don't want to bring it up, because I don't want to reinforce or make real the anxiety. So what I'm going to do as the adult in the situation is just not mention it, and we encourage a kind of avoidance. So we need to watch out for those things. Very often it's surprising how dealing with negative feelings tends to be significantly as much about what not to do, and in fact, often it's about not doing things as it is about doing things. And it's about learning how to calibrate when to take action and when to slow down and connect. And indeed, that is step number 3, is to learn how to cultivate a sense of resonance and attunement, which sound like kind of esoteric terms, but when you click into it, you probably will feel what I'm talking about, and perhaps those words will resonate. I didn't plan that, but it worked out. So at any rate, what this can look like with a kiddo, let's say we've got a kiddo who's anxious, and maybe the anxiety is the kiddo is being kind of defiant or gamey or avoidant about taking the garbage out at night. And I think this is an example that I've, like a hypothetical that I've brought up a few times on the channel. But what we come to find out is the kiddo is terrified of the dark, is maybe terrified of like rodents or bugs or something like that, particularly at night around the garbage. Now, certainly at some point, we need to talk about a reasonable plan of action for mastering this anxiety and not allowing it to dictate so powerfully our actions. But we do well to slow down and connect in that situation, which is to say something like, wow, you feel so nervous, and I'm sure that it's really powerful in your body. Maybe your stomach has got butterflies, maybe you feel your muscles tense, maybe your jaw is clenched, maybe your breath is, you're breathing really fast, or your heart is really pounding. Maybe your skin is having kind of, tingly or hot and flashy, sensations from a lot of adrenaline being dumped into your system. The bottom line is, if we can connect and resonate, that is really, really important, because what we do with the kiddo really helps to encourage the kiddo to do with, him or herself. And that's so helping kiddos process feelings is complicated for us, because we have to kind of do for and with kiddo and ourselves kind of at the same time. And it can be quite a journey. And very often when I've worked as a therapist with kids and parents, which is a lot, I've found that very understandably and normally, and in a way that's perfectly okay, but very often a big part of the journey is the adult in the situation learning how to themselves relate with comparable painful feelings that their kiddo is experiencing in a new kind of way, which seems to also help facilitate kiddo doing the same thing. And this is not necessarily to blame anyone for anything. It is completely normal and okay that, especially with the people that we're close to and trust, such as family members and perhaps coworkers and bosses that we're close with, that we tend to be greatly affected by their ways of being. And that's especially true when we're 8 years old. And we're in a position where we only have an 8-year-old brain, we only have 8 years of experience, we have an 8-year-old body, and we just don't have the same kind of emotional and mental and even physical resources that the adult does. So, of course, it's very understandable that we're a little bit more dependent, and we're quite affected by how things are going in that situation. That's good and normal for everyone. So, these are 3 ideas for some ways to help kids process negative feelings. These 3 things that I've offered are certainly not the final answer to everything, but they're 3 good general guidelines that I have found to be particularly useful in pretty much all situations that I've worked in. So I hope this video was helpful. Please consider subscribing using a button down below and giving this video a like. And watch out for more content in the near future. Thank you. This is Dr. Brett Pearce, signing off.